Hello all, this is Dr. Dheeraj Masapu and this video is about the recent Air India crash which has happened, and then my condolences to all the families actually who lost their loved ones in this event. And basically I've written a big draft. I'll read out. So basically what happened is there are so many theories which are coming into the in the form of videos, but exact reason for the crash nobody knows. But I'm not so many theories are there, like engine failure, or birds would have gone inside, or some electrical disconnection or faulty fuel, or so many things people are actually talking about. Mainly the pilots who have experience are also talking about, but we don't really know till the government announces what exactly is the reason behind this crash. So I'm no expert in that, but in this particular event, what I would like to tell my fellow doctors is a few lessons I learned from this particular event I would like to tell you. So let me tell you before going into these lessons why I am doing this video. Basically, I am an anesthesiologist, and why am I reacting to this particular event? The reason being, there are some similarities between anesthesiologists and pilots particularly. Okay, many of you, if you're other specialty doctors and if you're lay people watching this video, you wouldn't be knowing what are the similarities. So mainly the main similarities between anesthesiologists and pilots are both the departments work in high stakes environments. High stakes environment means environments where the possibility of crisis happening is very high. So then you need to be a little not mentally strong. You should have to be trained in such kind of events when crisis happens. So that's why we go through a lot of simulation training, and we also get trained in different crisis situations along with our seniors, and we look at them and then we learn, so that our subconscious will be trained when some crisis happens. So then if you ask me what about other specialties, are they not managing crisis? So they also manage crisis, but the crisis that we manage is more of life and death. For example, a physician or a surgeon, they also manage crisis, but the thing is that if something happens, they can actually abandon the procedure and then come back. But for anesthesiologists, there is no coming back. It is more like a pilot. When the takeoff is done, he needs to land the flight. There is no coming back in between. So once we induce a patient, there is no coming back. We have to extubate the patient. We have to follow the complete process. So that is the actual similarity. And the next similarity, which between the pilots and anesthesiologists, the machine interface that we have. So the pilot also has a lot of interface, and then even anesthesiologists, what happens is we deliver anesthetics with the help of machinery basically. So we are the only specialty where if machine fails, we will get into crisis. You can see the machines that we work on. These are the anesthesia machine. It is in standby now, but these are touchscreen machine. It will have a lot of settings in it. Okay, a lot of checklists, lot of tests we have to pass before actually we start the anesthesia. This is a mandatory step when we actually give anesthesia. So this is also similar to pilots, where a pilot also will have a lot of checklists, and there will be an SOP that they have to follow. So only after that he will take off the flight. Only when we pass through the tests which are done in the machine, we will start giving anesthesia for the patients. Because of these similarities, I am actually reacting to this particular event, and the lessons which I learned, I am going to tell my junior anesthesia colleagues. Lesson number 1, and the most important one, is all the anesthesiologists and my juniors, you have to understand that system failure can happen despite of all the checks that we do. So you would be thinking, in my experience I have so many times seen that there are so many problems which can happen when we give anesthesia despite of following the SOPs, despite of following all the checks that need to be done. And there are events which can bypass all the checklists and go. Okay, this is explained by a model called a Swiss cheese model. You can refer to that in Google. A Swiss cheese will have certain holes, but when you place all the Swiss cheese side by side, you cannot actually see the holes because they will never be aligned. But 1 in a million times it can align. So that is a bad luck actually. So this 1 in a million times it will align, and what happens is the problem which is there on one side, which will cross through all the checklists, and it will bypass everyone. It will bypass the junior technician, it will bypass the senior technician, it will bypass junior anesthesiologist, it will bypass the senior anesthesiologist, and it will present as a disaster in the OT environment. So these kind of things will happen very rarely, but they will happen despite of all the checks. That is a very important thing. Why I'm telling this lesson is I don't know what really happened in this airline crash, but there are certain issues. Despite of checking, also they can bypass every layer. If you have any doubt, you can go to the Swiss cheese model and how a problem will actually bypass through every layer and it will manifest as a problem. This is the first lesson that I learned. Okay, so if you ask me then what is the solution for this, always there should be a backup plan B should be very strong. For example, there is a problem in the anesthesia machine, and then what happened is suddenly machine is shut down. Okay, and then there should be a backup oxygen cylinder which will always be there with the machine, but you should check that. And then a main circuit also should be there, so that doesn't require any technical electrical circuits there. That should be a plan B. Like that, every in airway also you should have a plan B. Everywhere you should have a plan B. So that is a solution, because you can never assume that nothing is going to go wrong because you have done all the checks. There is always this 1 in a million risk of something going wrong. And the second important lesson is always you have to get trained in high stakes environments. Let me explain. See, many people are trained in simulations and then other situations. So simulation actually creates a high stakes environment. Even you use a virtual reality, but in the back of your head you always know that it's not a real situation. So you need to get trained in real situations, and you should be the responsible guy behind that. Only then you will actually get trained in a real situation. That is what is very important thing. And why I'm telling this is when you're responsible, when you're in high stakes situation or a period of time when you're dealing such situations, your subconscious would be trained. Let me explain you. When an event happens, when a crisis happens, your cortex, your cerebral cortex will actually stop working. It will go into something called as a mind block. At that time, your past memories, your past experiences which are saved in your limbic system and thalamus and hypothalamus and reticular formation, that is called as a spinal level or subconscious level. So that will actually take over, and that will actually lead to managing the crisis situations. For that, you have to adequately get trained in high stakes environments. So that is what is much required. It is not how many cases you have anesthetized and how many cases you have dealt smoothly, how many times you got stuck in situations, how many times you actually came out and you are the responsible, not watching somebody coming out. When you are responsible, how many times you came out will decide how you are going to deal your future situation and crisis. So for that, you have to work in high stakes environment at least for 4 to 5 years. Only then I feel you will become a very safe anesthesiologist. And lesson number 3 is attention to detail. See, there is no compromise in few things. For example, see, if you feel that some equipment is not working well, if you feel that some kind of airway device is not working well, you feel that the endotracheal tube has some issue, you can never go ahead with the procedure, thinking that nothing will go wrong. Okay. So there is a law called Murphy's law. It says that if something is going to go wrong, it will go wrong surely. So if you feel that there is some issue with the patient or patient side, or in the equipment side, or in the airway side, or any side, if you feel there is some kind of issue, then you cannot go ahead by starting the case. And you need to be obsessed with all the things, particularly field like anesthesia. What happens is if you take something light, then it will lead to the death of a patient. So you cannot take anything light. You have to make sure everything is perfect before you induce a case. If you feel you're not confident, if you feel that there is some factor in the patient which is not allowing you to start the case, please tell the hospital and surgeon that you cannot start that case. Please postpone it. And then don't think that people will think wrong about you. People might think inefficient, that you cannot do that case. All those things. This one case is not going to decide your career. So, but if you don't take adequate precautions, that particular patient is going to get a very bad outcome. So it is not about your efficiency and your skills and all that. Always think about having a very safe path for the patient. If something is not good, then please don't go ahead. That is another lesson which I learned. So the last lesson is that understand the need for having a team. one man army show wouldn't happen. So always have equal caliber guys in your team. Always, if you're a leader, when you're hiring, hire best guys. And best guy mean best skilled guys who are trained in high stakes environment, who are trained in best centers. And or you know, have one or two guys like that and two or three juniors and train them to your level. In that way you form a team where you guys together should manage the crisis, because alone you cannot deal such kind of situations. It's not one man's show when we are dealing actually situations like this. So what we need to do is we have to rely on our team, and we have to train the team, and then we have to constantly go through grilling episodes of crisis. Only then we can actually manage crisis when it really happens. So these are the lessons I learned, and these are the things I thought I should tell my juniors. And then I really felt very bad when so many medical students died in the airline crash. This shouldn't happen. Getting a seat in BJMC Ahmedabad, is very difficult. I know, because I do a lot of videos for NEET and all that. When I interview students, I can understand how difficult it is to get seat in such medical colleges, and such bright students actually die today. And I think the government will find out what is the cause, and if we really understand the cause, then maybe they will try to prevent such kind of episodes happening in future. We really don't know what is the cause, but maybe we'll come to know. I think in due course of time we'll come to know. Let us see what exactly is the reason behind. So thank you all. Thank you for following the video till the end. Thank you.